Heart disease in women, understanding symptoms and risk factors. All women face the threat of heart disease. Becoming aware of symptoms and risk unique to women can help protect you from fatal heart conditions. Although heart disease is often thought of as a problem for men, more women than men die of heart disease each year. One challenge is that some heart disease symptoms in women may be different from those in men. Fortunately, women can take steps to understanding their unique symptoms of heart disease and to begin to reduce those risks. Cardiovascular disease generally refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain, or stroke. Other heart conditions, such as those that affect your heart muscles, valves, or rhythm, also are considered as a form of heart disease. Coronary heart disease, also known as ischemic heart disease, is a waxy substance called plaque that builds up inside the coronary arteries. These arteries supply oxygen-rich blood to your heart muscles. A heart attack is a sudden and sometimes fatal occurrence of coronary artery blockage, typically resulting in the death of part of a heart muscle, also known as myocardial infarction or MI. A heart attack happens when the flow of oxygen-rich blood to a section of the heart muscle suddenly becomes blocked and the heart can't get oxygen. If blood flow isn't restored quickly, the section of the heart muscle begins to die. Heart failure is a condition in which the heart can't pump enough blood to meet the body's needs. In some cases, the heart can't fill with enough blood. In other cases, the heart can't pump blood to the rest of the body with enough force. Some people may have both problems. The term heart failure does not necessarily mean that the heart has stopped or is about to stop working. However, heart failure is a serious condition that requires medical care. The heart has a natural pacemaker made of rapidly firing cells. Abnormal electrical current or blocked electrical pathways in the heart can cause irregular heartbeats. Anyone can experience arrhythmias, and the risk becomes more common with age. There are other factors that put particular individuals at larger risk for arrhythmia, such as caffeine, smoking, alcohol overuse, amphetamines, and other drugs or medicines. Strong emotional stress and anger can also lead to arrhythmias in some people. Damage to the heart's electrical system from a heart attack or disease can also lead to arrhythmia. An arrhythmia is a problem with the rate or rhythm of the heartbeat. During an arrhythmia, the heart can beat too fast, too slow, or with an irregular rhythm. Most arrhythmias are harmless, but some can be serious or even life-threatening. During an arrhythmia, the heart may not be able to pump enough blood to the body. Lack of blood flow can damage the brain, heart, and other organs in the body. Heart attack symptoms for women. The most common heart attack symptom in men and women is chest pain or discomfort. However, only half of women who have had a heart attack have chest pain. In men, angina often feels like pressure or squeezing in the chest. This feeling may extend down to the arms. But women, however, also tend to describe a sharp, burning chest pain. Women's heart attack symptoms also can cause upper body discomfort in one or both arms, the back, neck, jaw, or upper part of the stomach. Other heart attack symptoms are lightheadedness and dizziness, which occur more often in women than men. Women are more likely to report indigestion, heartburn, nausea, feeling sick to the stomach, vomiting, extreme fatigue or tiredness, or problems breathing. In men, angina tends to worsen with physical activity and go away with rest. Women, on the other hand, are more likely than men to have angina while they're resting or sleeping. Heart disease risk factors for women. Diabetes increases the risk of heart disease significantly more in women than in men. Metabolic syndrome, a combination of fat around your abdomen, high blood pressure, high blood sugar, and high triglycerides, has a great impact on women than on men. Although the traditional risk factors for coronary artery disease, such as high cholesterol, high blood pressure, and obesity, affect women and men, other factors may play a bigger role in development of heart disease in women. Triglycerides are a type of fat found in your blood. When you eat, your body converts any calories it doesn't need to use right away into triglycerides. The triglycerides are then stored in your fat cells. If you regularly eat more calories like carbohydrates and fat, you may have a high triglycerides. There are two main types of cholesterol in the body, HDL and LDL. LDL cholesterol is more likely to clog blood vessels because it carries the cholesterol away from your liver into the bloodstream where it can stick to your blood vessels. HDL cholesterol, on the other hand, carries the cholesterol back to your liver where it can be broken down. A simple blood test can reveal whether your triglycerides and cholesterol fall within normal ranges. Heart disease risk factors for women. Mental stress and depression affects women's heart more than men. Depression makes it difficult to maintain a healthy lifestyle and follow recommended treatment. So talk to your doctor if you're having symptoms of depression. Smoking is a great risk factor for heart disease in women than in men. A lack of physical activity is a major risk factor for heart disease. Low level of estrogen after menopause poses a significant risk factor for developing cardiovascular disease in the smaller blood vessels. Pregnancy complications, such as high blood pressure or diabetes during pregnancy, can increase your risk of heart disease. What can we do to reduce our risk of heart disease? Quit or don't start smoking. Exercise 30 to 60 minutes a day on most days of the week, or 60 to 90 minutes if you need to lose weight. Maintain a healthy weight. Eat a diet that's low in saturated fat, cholesterol, and salt. Talk to your doctor about your specific medical history and discuss a plan to help reduce your risk of heart disease. Please visit the American Heart Association Go Red for Women to read more on potential risk factors for women. Thank you for joining me in raising awareness in cardiovascular disease for women.